Your doctor checked your blood pressure at your last visit, maybe your cholesterol, maybe your blood sugar, and then you were sent home with no one looking at the one marker that new research now connects directly to whether you're going to fall. Not whether you feel unsteady, whether you actually will. That gap matters more than most people realize, because a fall in your 60s or 70s isn't just a bad day, it's often the event that changes everything. And the numbers behind how often it happens and how badly it ends keep climbing even as medicine gets more sophisticated. More checkups, more medications, more safety equipment. And still the rate goes up, which means something is being missed at the level of the blood work before any of this starts. That's exactly what a recent study published in the Journals of Gerontology set out to find. And what it found is something your lab results may already be telling you, if anyone thought to look. Here is your complete, verified, word-for-word script. In 2024, 43,020 older adults died from preventable falls. That number has been quietly climbing for years, and here's the part that almost nobody talks about. Your doctor probably checked your blood pressure at your last visit, maybe your cholesterol, maybe your blood sugar, but almost certainly not the one marker that new research now links directly to how steady you are on your feet. Over 14 million older adults, 1 in 4, report falling every single year. Not tripping a little, falling. And most of them had no idea anything was off before it happened. That's the pattern researchers keep finding. Small, easy-to-dismiss wobbles, quiet instability that builds for months, and then one morning it isn't there when you need it. A reach for a shelf, a turn too fast, a last stare that doesn't go the way it should. This video is about what's actually driving that. A study published in the Journals of Gerontology found a routine blood marker, one that's already sitting in millions of people's medical records right now, is directly connected to balance and fall risk in older adults. We're going to break down exactly what that marker is, what the science says, what else is quietly working against your stability, and the one movement practice that clinical trials show cuts your fall risk by nearly a quarter. Stay to the end, because the fix here is genuinely simpler than you'd expect, and it's the part most people never hear about. If you're new here, welcome. This channel breaks down real research on senior health. No jargon, no scare tactics, just what the science actually says and what you can do about it. Hit subscribe and the bell so you don't miss next week. And before we go further, everything here is educational, not a diagnosis. Always talk to your own doctor before changing anything about your health routine. Now let's get into it. For a long time, falling was treated almost like an unavoidable part of getting older. You lose some strength, your reflexes slow down, and eventually you take a tumble. That was the story. Most of us heard it from our own parents and grandparents, and most doctors weren't pushing back on it too hard either. But the data tells a very different story. Falls are the leading cause of injury-related death among adults ages 65 and older, and the fall death rate is increasing. The age-adjusted fall death rate increased by 21%, from 64.7 per the 100,000 older adults in 2018 to 78.4 per 100,000 in 2024. That's not a small shift. And this is happening in a generation that has more access to grab bars, walkers, fall prevention programs and medical care than any generation before it. Something else is changing in how our bodies age, and researchers have been trying to figure out what. Here's why this matters beyond the fall itself. In 2019, 83% of hip fracture deaths and 88% of emergency department visits and hospitalizations for hip fractures were caused by falls. Each year, nearly 319,000 older people are hospitalized for hip fractures. And a hip fracture isn't just a broken bone. The cascade of complications that follows, reduced mobility, blood clots, pneumonia, loss of independence, is what makes these events so dangerous. Which is exactly why catching the warning signs early matters so much more than treating the injury after it happens. So, what is the warning sign almost nobody is looking for? That's where this gets interesting. A study published in the Journals of Gerontology, Series A, looked at the association between systemic inflammation and balance and falls in older adults. C-reactive protein, CRP, a biomarker of inflammation, has been linked to various health issues, including declines in physical function. CRP is not exotic or obscure. It's one of the most commonly ordered blood tests in medicine. Your doctor may have already checked it after surgery or if you've had an infection, because it rises whenever there's inflammation somewhere in your body. Think of it like a smoke alarm. It doesn't tell you exactly where the fire is, but it tells you something is burning. The problem is most people only get it checked when something obvious is already wrong. And here's what the research found when they looked at it in a completely different context. The researchers analyzed data from over 1,215 participants aged 60 and older through the National Health and Nutrition Examination Survey. They measured each person's CRP level, and they also measured each person's balance using a standard clinical test called the Modified Romberg test. Essentially, how steady someone is when you take away some of the usual cues the body relies on to stay upright. The result? People with higher CRP levels had measurably worse balance, and the association showed up more strongly in men than in women in this particular data set, which is worth noting because inflammation's effects don't always look the same across sexes, and it's one more reason this line of research deserves more attention. Now, here's the part that makes this study more than just an interesting observation. The researchers used Mendelian randomization to explore CRP's causal role in fall risk. Here's a simple way to think about what that means. Normally, when two things show up together, higher inflammation and worse balance, you can't be sure which one is causing the other, or whether some third factor is causing both. Mendelian randomization gets around that problem by using naturally occurring genetic variations that influence a person's CRP levels from birth, essentially a natural experiment that nobody chose to be part of. If people with the genetic variants linked to higher lifelong CRP also tend to have worse balance, that's much stronger evidence of a real cause and effect relationship. Not just two things that happen to travel together. That distinction matters a lot because plenty of things correlate with poor balance without actually causing it. So why would inflammation affect balance at all? Your balance depends on a constant split-second conversation between your inner ear, your eyes, the nerves in your feet and joints, and your brain, which processes all of that information and tells your muscles how to adjust. Older people who display an elevation in CRP levels over time experience an increased risk of adverse aging outcomes. Biological aging is characterized by a chronically active immune system, and elevated levels of inflammatory markers in older age, in the absence of acute infection, have been described in many studies, with the term inflammaging coined to describe this phenomenon. That chronic, low-grade inflammation, the kind that doesn't cause pain or fever, the kind you genuinely cannot feel, interferes with nerve signaling and muscle function over time. And when that system gets disrupted quietly over months and years, balance is one of the first things to go. Here's the honest gap in the system, and this is the part worth paying attention to. CRP testing isn't part of a standard annual physical for most people. It's usually ordered reactively, after a fall, after surgery, when infection is suspected. More than 1 out of 4 older people falls each year, but less than half tell their doctor. And falling once doubles your chances of falling again. That means, for most people, the first real test of their balance is the fall itself. By the time it gets noticed, there's already been an injury, a hospital visit, sometimes a hip fracture, and the window to prevent it has already closed. This isn't about blaming doctors. Primary care visits are short, and there are dozens of things to screen for. It's about you knowing this connection exists so you can bring it up yourself, which is often exactly what moves a question up the priority list at an appointment. What do you actually say? It doesn't need to be complicated. Something like, I've read that inflammation markers like CRP might be connected to balance and fall risk. Could we check mine, and could you take a quick look at how I balance? That's it. Most doctors will either order the test, explain why it's not necessary in your specific case, or point you toward a physical therapist who can do a more thorough balance assessment. Any of those outcomes is a win, because now it's a documented, tracked part of your care instead of an unknown. And before we get to the fix, which I promise is worth waiting for, there's something else worth knowing. Inflammation isn't the only quiet factor. A few others that often travel alongside it. Medications, many common prescriptions, blood pressure medications, sleep aids, certain antidepressants can affect balance or blood pressure when standing up, especially in combination. If you're on 4 or more medications, it's worth asking a pharmacist or doctor to review them specifically for fall risk, not just individually. Vitamin D. Low vitamin D has repeatedly been linked to muscle weakness and fall risk in older adults, and it's a simple blood test to check alongside CRP. Vision. Something as ordinary as an outdated eyeglass prescription can throw off your depth perception enough to change how confidently you step. And it's the kind of thing that drifts gradually without feeling like a big change. None of those are meant to alarm you. They're a short, practical list. Inflammation, medications, vitamin D, and vision. 4 things worth bringing up at your next appointment. Here's a short list of signs that your balance may already be quietly declining, worth paying attention to, not panicking over. Holding on to furniture or walls more than you used to, even briefly. Feeling unsteady when you turn around quickly. Noticing you sit down harder than you used to without meaning to. Avoiding stairs or uneven ground you used to walk without thinking. Feeling less confident in the dark, on grass, on sand, or on gravel compared to a smooth floor. And needing more time to recover your footing after being bumped or jostled in a crowded store. Here's a simple test you can try right now, safely near a wall or countertop. Stand with your feet together, arms crossed over your chest, and see how long you can hold that without touching anything for support, aiming for 10 seconds. This is a simplified version of the same kind of balance test researchers use. If that feels genuinely difficult, that's useful information, not a diagnosis, and worth mentioning at your next appointment. Remember the open question we planted at the start, the one about the fix being simpler than you'd expect. Here it is. The strongest single piece of evidence for reducing falls in older adults isn't a supplement, isn't a device, and it doesn't require a gym membership. A meta-analysis of 24 randomized controlled trials found that Tai Chi can effectively reduce the risk of falls in older adults, with a relative risk of 0.76, meaning roughly a 24% reduction, and also decreases the number of falls. That's not a small effect. That's the kind of number that gets a drug approved. Tai Chi also improves balance ability in older adults across multiple measures, including the timed up and go test, the functional reach test, single leg balance, and gait speed. And subgroup analysis showed that Tai Chi is effective for both healthy older adults and those at high risk of falls, and its effectiveness increases with the duration and frequency of exercise. Why does something that looks so slow and gentle work so well? Because Tai Chi trains exactly the system we talked about earlier, the real-time coordination between your eyes, inner ear, joints, and brain. Unlike static stretching, it constantly shifts your weight, slowly and under control, forcing your body to make the same micro-adjustments that keep you upright when you catch your foot on a curb in real life. You're essentially practicing balance in motion, which is what balance actually is. Compared to other types of exercise, Tai Chi has fewer requirements for equipment, venues, and caregivers, making it a more accessible form of exercise to promote. You don't need a class to start. Here's a simple 3-part routine inspired by the core movements used in these trials that you can try at home, ideally near a wall or sturdy chair for safety at first. First, weight shifts. Standing with feet hip width apart, slowly shift your weight from your left foot to your right foot and back, keeping movement slow and controlled for about 1 minute. Second, the single leg hold. Holding onto a chair if needed, lift one foot slightly off the ground and hold for 10 to 20 seconds, then switch. This movement is used in balance research as both a measurement tool and a training tool. Third, slow heel-to-toe walking, like walking a line for about 10 steps, turning around slowly and repeating. Even 5 to 10 minutes of this, most days of the week, builds the same kind of coordination the Tai Chi trials measured. A quick safety note: if you have a condition affecting your balance already, low blood pressure, or a recent injury, do this near a wall or with someone nearby the first few times, and check with your doctor before starting, especially the single leg hold. If you want a simple way to build this into your week, here's one option. Monday, Wednesday, and Friday, do the full 3-part routine, about 8 to 10 minutes. Tuesday and Thursday, just the single leg holds, a few rounds each side while you're brushing your teeth or waiting for coffee to brew. Researchers call this habit stacking, attaching a new habit to one you already do automatically. Weekends, if you're up for it, a short walk on slightly uneven ground like a park path instead of pavement challenges your balance in a more real-world way. A local senior center or community class that offers actual Tai Chi is a great next step if you enjoy this, since a real class adds the guided, gradually progressing structure the clinical trials used. On the inflammation side, the research consistently points to a few habits. Regular moderate movement, which Tai Chi itself provides. Adequate sleep, since poor sleep is linked to higher inflammatory markers. And a diet with more fiber, vegetables, and omega-3 rich foods like fatty fish and less ultra-processed food. Small, consistent changes are what the research actually supports. Not a dramatic overhaul. A few quick things people often ask about this. Should I just take an anti-inflammatory supplement instead? Not without talking to your doctor first. CRP is a marker, not a target. Artificially lowering the number without addressing what's driving it isn't the same as actually reducing your fall risk, and some anti-inflammatory medications carry real risks for older adults, including effects on the stomach and kidneys. I already had a fall, though. Is it too late? No. Tai Chi is effective for both healthy older adults and those at high risk of falls, and the research shows benefits even in adults starting in their 80s and 90s. It's never too late to start training balance. What if I have joint pain and can't do a full Tai Chi class? Every exercise here can be done seated or with support. The weight shift and heel-to-toe movements can be modified to smaller ranges of motion, and a physical therapist can tailor a version specifically to your joints. The goal is consistency, not intensity. If this video gave you something worth remembering, do 2 things before you close out. Write down, ask about CRP and a balance check before your next doctor's visit, and try that 3-part routine this week. Not next week, this week, while it's still in your head. And if you found this useful, drop a comment below and tell me, have you ever had your CRP checked? Did your doctor bring it up or did you have to ask? I read every comment, and your answers genuinely help shape what we cover next. Hit the like button if this was worth your time, and subscribe so you don't miss next week's video, where we break down another piece of research most people never hear about. Take care of yourself.